Hello, my dear students. I'm Dr. Jayaprakash K, the Professor of Forensic Medicine. Let me start the early session on Forensic Medicine Toxicology recall session. Okay, I got about 13 questions in INICET this time of May 2025. Let me go for the first question. Okay, one of the following statements regarding venom is incorrect. Very easy question. Common cobra, neurotoxic. Common crate also neurotoxic. Both common cobra and common crate falls under the species Elapidae. That means Elapidae is neurotoxic. Viperidae, like Russell's viper and soft-scale viper, definitely it is hemotoxic. So wrong answer is Elapidae. Elapidae are neurotoxic. Actually, sea snakes are myotoxic. Now coming to the question number 2, the triad of abrasions, bruises, and punctate lacerations are seen in. All of you know very well, it is one of the easiest question. I think none of you must have made any mistake in this. That is known as Marshall's triad, which is seen in bomb blast injury. Multiple small abrasions, bruises, and lacerations. Punctate, small lacerations. The combination is commonly seen in bomb blast injuries. Number 3, one of the following is not seen in a worker who is working in a thermometer manufacturing company. Thermometer means they use mercury. So what is the toxicity in case of mercury? Mercury, you know very well. It gives rise to a condition called erethism, where there is a psychiatric manifestation that is known as Mad Hatter disease. At the same time, you get Danbury tremors, glass blower tremors, or Hatter's shakes, as well as concussive mercurialis. All these are seen. Basophilic stippling, usually it is seen in case of lead poisoning, but at the same time, it can also be seen in case of bismuth, iron, silver, mercury, as well as copper. In copper, it is known as Clapeyron's lines. Peripheral neuropathy is one of the findings in case of chronic mercury poisoning, but Mees lines or Aldrich Mees lines is seen in arsenic, and in thallium poisoning, we call it as Mees lines, that is seen in arsenic poisoning as well as thallium poisoning, not in mercury poisoning. So answer here is Mees line. Now, all three are very easy questions. The dental numbering system as shown below follows. Strictly speaking, I'm not happy with this question, but it's okay. You can, by using your common sense, you can answer. See, what happens is, in case of Palmer's notation, the teeth are numbered from medial to lateral 1 to 8. But when you denote those particular tooth, you write within the quadrant shape. Now you see, this is the quadrant shape you are supposed to write. For example, upper left central incisor, you have to put L. Within that, you have to write 1. But anyway, 1 to 8, 1 to 8 from medial to lateral. Well, in case of FDA formula, okay, now I'm showing here MFDA formula, that is modified Federation Dentaire International formula. One more is Federation Dentaire International FDA formula. There is no much difference. Here it is known as the upper right quadrant. Quadrant are numbered 1, 2, 3, 4 clockwise in case of FDI, zigzag in case of modified FDI. First, you have to write quadrant number followed by tooth number. So you can rule out this option. Universal system contains number 1 to 16 for upper teeth, then 17 to 32 for lower teeth. Order system, upper teeth are denoted with plus, lower teeth denoted by -1, remaining same, 1 to 8, 1 to 8, 1 to 8, 1 to 8. But plus or minus will be there in order system. So here, the answer is Palmer's notation. So what I feel, if you have studied this dental notation, this is also very easy. Number 5, minimum age of a girl who can give consent for MTP is, okay, I'm sorry, I was typing urgently. Answer is already given. Okay, options are 12, 16, 18, 21. Look here, any girl can go for medical termination of pregnancy. MTP Act 2021 never mentioned, but the consent part is very important. A girl below the age of 18 years cannot give consent for medical termination of pregnancy. Her parents or legal guardian has to give consent. And if a girl is more than 18 years, She herself can give consent, whether she's married or unmarried, unless she is mentally ill. If she's mentally ill, again, legal guardian. So here, as you know very well, the answer is 18 years. Number 6. Opinion number 2 doctors are required for MT per the gestation period of. Again, easy question. I said 1, 2, 3 are easy. Now 4, 5, 6 also easy only. Okay. Now here, normally, medical termination of pregnancy is done on general condition up to 24 weeks. Up to 20 weeks, opinion of one doctor is sufficient. 20 to 24 weeks, opinion of 2 doctors. Then more than 24 with substantial fetal abnormality, it has to go a medical board consisting of 4 doctors. Or in case of emergency, anytime, even 1 doctor can do that, you know. So here the answer is 20 to 24 weeks. Now, in which of the following poisoning, the filter paper impregnated with silver nitrate turns black on exposure to gastric lavage content? Not only gastric lavage, even you impregnate a filter paper in silver nitrate and expose it to the breath of a person suspected to be taken aluminum phosphide, then it turns black. This is also previous year question. I think just last year they asked in INICET again. Not INICET, FMG they asked, I think. Okay. Number 8. A patient has been brought to emergency room with issue of burns involving face, both upper limbs and front of chest. You know, rule of 9. Both upper limbs, 9 plus 9, 18. Front of the chest, only 9. 18 plus 9, 27. Okay. 27. You know, head and neck is 9%, but only head is 7%. Only face you can consider about 3%. So best answer is 27 to 30%. 27 to 30. Okay, I told last moment I typed, actually last it was supposed to be 45 to 48. It is not 25 to 48. Okay. This is in a urgent manner you have prepared this. Okay. Match the following. Very easy again. Lead, metallic irritant. Cocaine, CNS stimulant. Proton is a irritant plant or plant irritant that falls under organic irritants. Opium, somniferous poison, which lessens the pain and induces sleep. Datura, delirium poison, which causes delirium. Okay. I don't want to repeat again. Repeat in the sense, A, lead is 4, cocaine 2, cocaine 3, croton 5, opium 2, datura 1. Okay, very easy question. As per Bharatiya Nyaya Samhita, one of the following is not a grievous hurt. Previously, Section 320 IPC is to say that any hurt which endangers the life of a person or which causes the sufferer to be during the space of 20 days in severe bodily pain or unable to follow his ordinary pursuits. But now you know very well, they changed it according to BNS 116. It is 15 days, not 5 days. Loss of a member, of course, grievous hurt. Emasculation is grievous hurt. Dislocation of elbow, grievous hurt. Now, next question. The organization responsible for medical record safety. This is an unexpected question. This act passed in the year 2023, the Digital Personal Data Protection Act. According to that, what we used to teach in forensic medicine regarding professional secrecy and privileged communication, now they started talking like confidentiality. Confidentiality and breach of confidentiality. Confidentiality means you have to maintain the professional secrecy. Breach of confidentiality means privileged communication. That is covered under the Digital Personal Data Protection Act 2023. Now, question number 13, I don't know exact option, you must be knowing. If you know the option or even the question, you please send a message, okay? Cyanide exert toxicity by which of the following? It gives rise to histotoxic hypoxia, histotoxic anoxia, or molecular anoxia, or cellular anoxia, or cellular hypoxia. because it inhibits the enzyme cytochrome oxidase. Okay. See, these are the 13 questions. Out of 13, accept that previous question by using your common sense. Of course, I don't think they have mentioned Digital Personal Data Protection Act. I think they have mentioned DPA. That is only bit unexpected. Otherwise, all other questions are expected. I hope you have done very well. You have any questions or anything, you please ask me. Okay. I just wanted to finish as early as possible because today you are in a enjoying mood. Wish you all the best. Happy weekend. Bye-bye. If you have any questions or anything, you please tell me, or if any modification in the questions also, you please send a message. Okay. Wish you all the best again. Thank you very much. Bye-bye.